Minister of Health Prof.Dr Eksavang Vongvichit has called upon all members of the public to help in the efforts to reduce the incidence of tuberculosis, or TB, in Laos. According to the minister, the government's and ministry's policy is to provide free diagnosis, treatment, and transport for TB patients.
เมื่อก่อนนี้131 ปีคือในวันที่24 เดือน 3 1882 ท่านดร. โรเบิร์ต โกส ชาวเยอรมัน
Minister of Health Prof.Dr Eksavang Vongvichit made the request on the occasion of the 131st World Tuberculosis Day, which is observed annually on March 24th. The day commemorates the day when Dr. Robert Koch presented his discovery of the TB Bacillus bacterium to a group of doctors in Berlin in 1882. This year's theme on World TB Day is Stop TB in My Lifetime, Call for a World Free of TB, aimed at raising a public awareness of tuberculosis and the efforts made to prevent and treat this disease. Professor Dr. Eksavang Vongvichit said, tuberculosis is an infectious disease and most commonly occurs in undeveloped countries where there is a lack of hygiene and sanitation or there is a lack of basic knowledge and regarding healthcare.
ตามการรายงานขององค์การอนามัยโลกคาดคะเนว่ามีคนเจ็บวัณโรคในทั่วโลก
According to World Health Organization, more than 2 billion people worldwide are currently infected with TB. An average of 9 million people worldwide contract TB every year. Of these cases, 3 million die from the disease, with most cases occurring in people aged between 15 and 45.
TB is spread through the air from one person to another.
Laos currently has the 5th highest number of TB cases in Asia Western Pacific region. An estimated 3.5 million people contract the disease in this region every year, with 300,000 of them dying annually.
กระทรวงสาธารณสุขเห็นว่าประชาชนเฮาในปัจจุบันนี้ก็ยังมีความเสี่ยงต่อการเป็นพยาธิวัณโรคอยู่
Professor Dr. Eksavang said TB control is a top priority of the Ministry of Health, and officials are working to raise funds for use in activities to control and prevent the disease, with the aim of gradually reducing infections and death rates. Despite Laos' efforts to combat TB, medical workers have identified an average of 4,000 to 4,200 cases from 2008 to 2012, with 93% of patients successfully treated. However, TB cases still surface in every province of the country.
ผู้ที่สงสัยมากวดนำแพทย์หมออยู่ห้องหมอและสำหรับคนเจ็บวัณโรคก็ต้องได้เอาใจใส่มาปิ่นปัวให้ครบตามคำแนะนำของแพทย์หมอ
Professor Dr. Eksavang said, patients should take their medicines in the presence of health professionals every day and provide a sputum sample after a few months of treatment to ensure there are no more TB bacteria present in their system. The government's and ministry's policy is to provide free diagnosis, treatment, and transport for TB patients. The project to control TB in Laos is supported by the government, WHO, the Damien Foundation, and the Global Fund to fight AIDS, tuberculosis, and malaria.